Good afternoon, dear patients. Today we will discuss a clinical case. Skin tumors. It is quite rare for the skin to develop tumors. Most often, these are basal cell carcinomas or basal cell cancer. You can watch a separate video about this on our channel, but today we will look at a somewhat different tumor. An elderly woman came to us who had developed nodules directly on the lower limbs. They were reddish-bluish in color and felt firm to the touch. This is a subcutaneous formation. They were located on the lower limbs as well as on the abdomen and chest directly. There were also swollen lymph nodes, and her general condition was periodically affected with symptoms such as fever, malaise, weakness, and so on. Well, in general, with such symptoms, a comprehensive examination is necessary. This is what I don't like in my practice. Dermatology patients always hope that the doctor will take one magical look at them and make a diagnosis. But with just a look, you can only roughly determine the list of tests that need to be done as recommended by the doctor. Patients, of course, are very dissatisfied because they're used to the dermatology clinic just prescribing them a hormonal ointment. You've seen it, or they just get passed around with Suprastin. Naturally, in this case, neither a hormonal ointment nor, in fact, most other treatments will help. Here you need general blood tests, biochemistry, allergy blood tests, and rheumatological tests. You also need to check certain pancreatic enzymes to rule out panniculitis, for example. A biopsy and histological examination are also necessary here. It's necessary here to examine the cellular composition directly. These are very expensive tests and all these examinations. The woman went through them all. Most importantly, she was found to have cells directly in this infiltrate that you see. In other words, this is a dense cellular infiltrate. I am palpating it directly. A mixture of B and T lymphocytes was found in her, meaning lymphoma. Cutaneous lymphoma is a relatively rare tumor, and my teacher, Professor Dionov, also studied it. What kind of lymphoma is this? This is a primary large cell lymphoma of the skin of the legs. It is even classified as a separate form, specifically in foreign literature. Why is it classified separately? Because firstly, it has a somewhat worse prognosis compared to other cutaneous lymphomas. Secondly, it is important to note that the most frequent primary anatomical location of this tumor is within the lower extremities of the human body. It most often appears in women over the age of 65, which was exactly the case in our situation. Usually bluish erythematous plaques and tumors appear on the lower extremities and on the abdomen, less commonly. Sometimes they turn into ulcers, but in our case this did not happen. And histologically, infiltrates are detected. These infiltrates directly affect the epidermis, the upper layer of the skin, as well as being located in the subcutaneous fat tissue. And they consist mainly of B cells, B lymphocytes, but also contain a small admixture of T lymphocytes. Therefore, in general, this is a type of tumor that occurs predominantly in women. It is also characteristic of this condition that the lymph nodes become enlarged. There can be painful areas on it. And directly, what should this condition be differentiated from? First of all, it should be differentiated from nodular erythema. You can watch a separate theoretical video about what nodular erythema is on our channel. In one of the upcoming videos, I will show a case of recent nodular erythema. What we are looking at here is a vascular lesion, which is also frequently defined by the clinical involvement of the patient's lower extremities. In this specific clinical case, the development of lesions within the lymph nodes and the abdominal cavity is not considered typical, and the same observation generally applies to the regions of the chest as well. Spontaneous panniculitis, inflammation of the subcutaneous tissue, can also be differentiated from similar diseases. However, there is no intoxication syndrome as seen in this patient. These represent the two primary clinical diagnoses. with which such diseases need to be carefully differentiated and distinguished. So what exactly do you need to know regarding the available treatment options? As a matter of fact, in this specific case, it's not just about simply applying a topical ointment. Full-fledged chemotherapy is absolutely necessary, combined with a course of immunotherapy. An example of such therapy is the COP regimen. I won't go into detail about what that is right now. You can look up what the COP regimen is on the internet, but honestly, that's not really the primary focus of this video. We're simply talking about what is generally used for treatment. And recently, immunotherapy has been used, specifically antibodies against CD20. For this particular case, they are also indicated. Naturally, it is preferable to carry out this therapy in a hospital setting. That's why we did not administer this kind of therapy. However, considering that this patient had already seen quite a large number of doctors, prescribers of Tavigil and Suprastin, in many cases this doesn't help at all. And of course, going from one Tavigil Suprastin prescriber to another, or to those who just prescribe ointments, often does not lead the patient to recovery. Moreover, it delays proper treatment and a full diagnosis. The sooner this is done, the better. Well, in conclusion, I can say that the average 5-year survival rate for such patients is about 60%. So basically, it's not as low as, say, in oncology, but it's also not as high as, for example, in more benign T-cell lymphomas. Therefore, when it comes to skin diseases that are seen by dermatologists, if you don't want to end up with a bunch of hormones and, accordingly, Tavigil, simplifying things you could just prescribe for yourself at home if you really wanted to, then, as a rule, a fairly comprehensive examination lies ahead. This woman underwent examinations in several laboratories. As far as I remember, to date, the total amount spent on various tests was about 70,000 rubles, including various histological studies, as I mentioned. Therefore, examinations and treatment for dermatological patients are always quite an expensive undertaking. And here, if you just want, as I said, to get an ointment and some pills, then take Tavigil or Suprastin, apply a hormonal ointment, and you'll get what, in principle, a dermatologist at your local dermatology clinic or polyclinic usually recommends.